Good afternoon. I'm Karen, and my skill that I'm going to perform today is to do an NIH scale on a patient. Unfortunately, I am by myself this week because all of my family is out of town. So, Mickey here has decided that he's going to step in and be my patient today. He and I have been around for a long time, so it's kind of nice to have him here with me. The reason that I'm doing the NIH scale, they're performed on patients who we suspect have had a stroke. And the NIH is performed to evaluate any deficits that the person may have, the severity of the skill. It also helps determine what kind of treatment that the patient may receive. And it also is a good predictor of the patient's outcome. There are 11 steps to this assessment. I'm going to follow this stroke scale worksheet that I have here. It's right here, if you can see. I'm going to follow this. It's very important that the nurse follow the worksheet or the assessment in a similar manner for each patient each time you do the assessment. That way you know that you're completing the whole assessment. And you, when you give it to the next nurse and they complete it in the same way, then you know that you're getting a similar measurement on the patient. So the first one that we're going to do, and obviously since Mickey can't respond, I'm going to tell you what his responses are for this assessment. The first one we're going to do is level of consciousness. So this is when you ask the patient if they can tell me their name, which Mickey can tell me his full name, and you also ask them their date of birth, and Mickey can tell me his date of birth as well. So he is alert, and he's going to score a 0 in that section for level of consciousness. And then the next one when we ask them is we're going to ask to do 2 commands. So generally what we'll do is we'll ask the person to make a fist. And Mickey can make a fist. So he scores good on that one. And then we also ask them to do another command, close your eyes. And Mickey is able to close his eyes. So on the first area of the NIH, he has gotten a 0 because he is answering the questions correctly. He is alert and he is oriented. He was able to tell me where he was at. The next one we're going to do is best gaze. And this is where you test the patient's eyes horizontally. And you're going to tell the patient not to move their head. They're just going to follow your fingers with their eyes. And you're going to go back and forth. And you're going to determine whether or not the patient is following your finger with their eyes. Mickey is able to follow my finger with his eyes. Therefore, he's getting a 0 for that one as well. And that was the second part of the test. The third one is visual. And this one is where you are going to test all 4 quadrants of the patient's eyes. Again, you're going to tell them to look forward and not to look at you when you do this. And generally, when you are doing this test, you are facing the patient or you're directly on the side. But with the video, I can't be in front of the patient because then you couldn't see what I was doing. But with this test, you generally wiggle fingers like this, and they are to tell you how many fingers they see. So you're going to test all 4 quadrants, and you're going to see if they can tell you how many fingers are in those quadrants. And Mickey got all 4 quadrants correct. So his visual is good. And then the next one is facial palsy. And generally, you ask the patient to smile. I've often asked the patient, show me your teeth, because you get a really good smile on the patient when you ask them to do that. And then there's a good laugh when they don't have teeth as well. Anyway, obviously, Mickey here has no facial palsy. His face is symmetrical, and I don't see any drooping on one side or the other. So he's doing very well with this one. The next 4 tests are going to be the motor skill tests. And in this one, what you're going to do is you're going to ask the patient to lift their right arm up in the air. Generally, it's at a 90-degree angle. and the palm is down, and they're to hold it for the count of 10. And you are to count out loud so the patient knows how long they have to go. So you're going to go 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So they know how long they have to hold it. And what you're going to look for is if the patient drifts at all, if they're able to hold it up at all to gravity, or if they just drop it totally onto the bed. And Mickey was able to hold his right arm up fine. Then you put that down and you're going to ask them to do the same thing with the left arm. They're going to hold it up, palm down, and you're going to ask them to hold it for 10, and you're going to count 10 down, again, so the patient knows how long they're holding it. So it's 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And again, you're going to see if they've drifted a little bit, if they were able to hold it at all, if it goes all the way down but doesn't touch the bed, or if it just falls right to the bed. And then you're going to ask them to do the same thing with their legs, but you're only going to count to 5. So you're going to have the patient lift their leg up, and they're going to hold it for 5, and you're going to count with them 5, 4, 3, 2, 1. Okay? And the same thing, you're looking for drift. See if their leg stays up, if it comes down a little bit before it gets to 0, or if it just falls all the way down. And then you're going to ask them to do the same thing with the left leg, and you're going to count again for 5. 5, 4, 3, 2, 1. Sometimes the patients have a hard time understanding what we're asking them to do. If there's dementia or, there's a lot of loud noises going on in the department. They're nervous. So sometimes you do have to kind of help them out a little bit. Sometimes you'll say, come on, I want you to lift your leg up. You're going to count to 5. And you put it up there for them, and then you see if they can hold it up or not. Same thing with the arm. Sometimes they just need a little bit of guidance, but you're not supposed to encourage them. You're not supposed to help them do the action. Only if there's a lot of noise or they're not sure what's going on do you kind of assist them a little bit, or you repeat the question. But when you're doing these skills tests, the patient needs to do it on their own. So after the legs and the arms, we're going to do the limb ataxia. And this is aimed at finding out if they have any loss of coordination. And so in this test, what they're going to do is you're going to tell them to take their finger, and it doesn't matter which one they start off with because they're going to do it on both sides. And they're going to touch their nose like this, and then they're going to touch your finger. And I usually have them do it 3 times. They touch the nose, and then they touch my finger. And they touch the nose, and I try to move the finger around so that it's not easy for them to do. And then you ask them to do it with the other hand, again, 3 times. And then the next one you're going to ask them to do is you're going to ask them to take the heel of their one foot and run it up and down the shin of the other foot. And then you're going to ask them to do the same thing and run it up and down the shin of the other leg. So Mickey has done really well during this test. He's able to touch his nose and my finger all 3 times with both hands. And he was able to run the heel of his foot up and down both times on both legs. So far Mickey, has done very well with this exam. He so far has no deficits that we have seen. The next one that we do is called sensory. And when I do this one, I always have the patient close their eyes because I don't want them to know where I'm touching. And I'll sit him up for this one so that you can see this one. And generally what we do is I will do this, and I'll say, do you feel that? And they'll say yes or no, and I'll say to them, does it feel the same or different? And they'll say it feels the same. And then I go down onto the arms, and I do the same thing. Meanwhile, their eyes are closed the whole time. And I'll say to them, does this feel the same or different? Well, Mickey actually tells me that in his right arm, it feels a little bit different than the left arm. It's a little less sensitive than the left arm. So he has a slight deficit in his right arm. And then I'm going to go down to the bottom, do the same thing. I'm going to touch his legs with my fingers. And I'm going to ask him, does this feel the same or different? And then again, he's telling me, oh, my right leg feels a little bit less than my left leg. This left leg feels more. So on this test, Mickey has some sensory deficit in his right arm and his right leg, which is the same as what he came in with his complaint. He complained of right arm numbness and left and right leg numbness. So with that test, he's going to get a, let me make sure I'm doing this. He's going to get 2 on on the sensory. So it's mild to moderate sensory loss. Because he still can feel it. It's just not the same as the other side. So he's going to get a 1 on that test. Then the next one we're going to do is called best language. And what we do with that one is we ask them to look at a picture, and I'm going to hold up the picture here, and I hope you can see it. I'm going to try to throw this on as an attachment if I can, but it's a picture, and I can tell you what's going on in the picture, although I'm sure you guys have seen this before. It's a mom washing dishes, and the water's overflowing, and then there's some kids, and they're on a cookie jar, and the boy's going to fall over. So generally speaking, I have the patient take a look at the picture, and I try to get them to describe as much as they can in the picture. And then it's kind of a judgment call. Sometimes the patients will say, Mom's washing dishes, and that's all he sees. You see anything else? No. Well, there should be more in there that he should see. He should see the boy on the stool falling over, mention the water is running out. So obviously there is some kind of deficit if the patient doesn't see the whole picture with this one. But Mickey's able to tell me everything he sees. He sees the boy, he sees the girl, he sees the mom, he sees the dishes, he sees the boy going to fall over. So he's able to tell me everything that he sees in that picture. And then he's going to also read these sentences for me. And these say, you know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night. Patient needs to read those to you. Make sure they have glasses with them. If they don't have their glasses with them and they can't read it, then you're going to have to just go by what they can see and just determine it that way. Because that's when you have your issues with a judgment call. Because if they don't have their glasses and they can't see it, you're going to have a difficult time with that test. And then on this picture, there's 5 items that the patient needs to tell you that they can see. And it's a glove, a key, cactus, a chair, a feather, and a hammock. And Nikki's able to tell me all those items on the picture. These are really important that you make sure that you have these pictures and these sentences for the patients to read. Sometimes nurses will just show the patient a pen and see if they recognize that, or their stethoscope and see if they recognize that. But that's not a consistent test. And if the patient goes up on the floor and the nurse starts showing them these pictures, the patient may not know what's on these pictures because they hadn't seen them yet. So that's when the best language you're looking for, if they can understand the language. And then the next test is a dysarthria test. Now, if the patient is intubated, then you would just write it down as untestable because obviously you can't ask them to repeat these words. And I would have the patient repeat after me. It's Mama, Tip Top, 50-50, Thanks, Huckleberry, and Baseball Player. And what we're trying to determine is their articulation in their speech. Are they slurring their words? Are they able to say these words? Mickey's able to say all of those words just fine. He's having no problem with his articulation. The last one is extinction and inattention, and this one sometimes gets missed because people forget how to do it. You're going to have the patient close their eyes again, and what you're going to do is you're going to, I often touch their face, and I'll ask them what they feel, what side am I touching, and they can say left or right, and then I'll just touch one side and see if they can determine which side, and then I'll touch the other side. Their eyes have to be closed while you do this. Again, I do that on their arms, and I do that on their legs. And you'll touch both sides, and then just one side, and then the other. And this is to determine if the patient has any inattention. If they just don't recognize that that they can't feel the other side of their body. So this is the NIH stroke scale. Some complications that you might have with this is possibly a nurse not understanding how to do it and scoring the person incorrectly. If the patient's ventilated, you might have some difficulties. If the patient's blind, doesn't have their glasses with them and can't see the information, or if the assessment's just not done properly. It needs to be done every hour, and then it needs to be done whenever there's a change in neurostatus. So the nurse needs to make sure that they're up on top of that. And thank you so much for listening to me, and I hope that I was able to explain it to you.